Good evening. We have another update on the coronavirus here in Kentucky. Again, it is expected and we are ready. The most important thing for the public is to remain calm, to practice good hygiene, and to understand we are all going to get through this. We're going to get through it together, and we're going to get through it by having good practices. As time goes on, we will have more positive cases. We need to expect that. Tonight we can report that we ran 13 cases today, 2 new positives, 11 negatives. Our new positive cases are 1 from Harrison County and 1 in Fayette County. We don't know that person at this time is a Fayette County resident. We have no additional details on those cases tonight. We should have more details at 9 a.m. tomorrow. When we will hold our next briefing. We do know that both individuals are in isolation. So this brings Kentucky's total number of positive cases to 6. 3 of those cases are in Harrison County, 2 are being treated in Fayette County, and 1 is in Jefferson County. So once again, we are ready. We're going to have more positive tests come back as time moves on. Stay calm, practice good hygiene. Wash your hands, wash them thoroughly, wash them repeatedly. If you are sick, do not go to work. If your child is sick, do not go to school. Some of the most important information that we can give right now is we all have to protect our most vulnerable populations. Those are people with heart, liver, or kidney disease. And there certainly are seniors. The CDC is talking about 60 and older, but certainly those older than that. To those seniors, avoid crowds. And I'm going to go ahead and say don't fly. That is our advice. And certainly do not get on a cruise ship. That was some of the information today from our call with the vice president and others. Everybody has a duty here when it comes to the most vulnerable populations in Kentucky. We need to make sure that not only do we practice the type of good hygiene to protect us and our families, but that we also need to practice good hygiene so that we don't infect other folks. Because most people that get this, as Dr. Stack has said, might not show symptoms at all, or they would be very mild. We have an important duty to make sure that we are not the person that ultimately infects someone that has a harder time battling this than others. The state is being active and aggressive in the way that we respond to this. We have a state of emergencies we've called. That gives us every tool that is available. We have activated our emergency operations center. We've had an executive order and steps we've taken in Medicaid to try to alleviate any costs related to testing, and we're going to have more steps tomorrow and as we move forward to make sure that we are doing everything possible and that we are reacting as fast as the information that we get. So again, Kentucky is now up to 6 positive cases, and folks, we're going to have more. That doesn't mean we're not ready. We are, and it doesn't mean that people should overly worry. We've just got to make sure that we take the necessary steps as we move forward, and we will come out on this of the other side. And I notice so many families, it's scary. We're going to be okay. Just listen to the important steps, follow them, and we will get through this together. So with that, I know there's not a lot of additional information tonight, but we're happy to take questions.
So in other states, we've seen them give a little bit more information, like ages, gender, that sort of thing. Why are we not releasing that sort of information?
I think we're going to be able to provide more information tomorrow, including some of that information. You know, it changes when you have just one individual case where that information might identify the individual so early that the epidemiologists don't have the opportunity. But as we go forward, I think we're going to be able to provide more of that, and you can expect some of that tomorrow morning.
The Louisville pastor, Pastor Cole, do state officials know if he had the coronavirus when he was here in the Omni Hotel?
Well, let me turn that over to Dr. Freelander, or Eric Freelander. I just made you a doctor.
Oh,
You were
thank
there
you.
today for that,
Appreciate it,
right?
yeah. I don't believe we know. That is not something that we would have any real idea about at this point.
When did the state become aware that he had contracted and he was in Louisville? Did someone inform the state?
Yeah.
I don't believe we have that information at this point. I think we primarily found out when
Right.
you all heard about it. It was the same time that we did.
And I believe earlier today, what Dr. Stack talked about is just because someone has it doesn't mean they're transmitting it. And I think that context is important for the public to know when they hear that someone in their community has had it. So if the person that has it is also practicing good hygiene, which is really important, the social distancing, the 6 feet, washing their hands, doing those things, then they might not be transmitting it to other people. So again, it's important that people know and have the facts. It's also important that those facts are in context so that people can be mindful, but ultimately not lose their mind to make sure that we don't cause fear, we just cause preparation.
Have you been having any internal discussions about steps you might take in the foreseeable future here in the Capitol?
Absolutely.
Limiting visits, obviously there are a lot of children who come here for school trips.
So we are having those conversations. They're ongoing. One of the steps that we're taking right now is we're doubling our cleaning as it's done here in the Capitol. We are also going through the protocols to make sure we are cleaning correctly. And we are looking at other options as this evolves. Ways that within the Capitol people could still be here to do business, but perhaps we engage in that type of social distancing. There are a number of different steps that could be taken. We're looking at best practices, many of which have to do with businesses. And while we still don't have one here in Franklin County, those are all things that we are considering, and we'll adjust as the situation warrants it. I'd repeat that we learn something new every day. This is a virus that didn't exist, at least we didn't know about it 2.5 months ago. And when wide-scale testing becomes available through private labs, we will probably learn a lot more. So we take the best science we have. We take the guidelines from the CDC. We respond using those appropriately, but a lot will change as we move forward, and we ought to expect that.
So is it 3 now in Harrison County?
Yes.
Is that correct? So do we know anything about the,
We
you might not be able to tell me anything right now, but are they related to that
We
original person?
we ought to have more information on the new test on the new positive case tomorrow. The 2 that we've previously been able to disclose are linked. We're not able to talk about that link yet, but we hope to be able to do so again once the epidemiologists just have a chance to get a little bit of their work done.
About the Lexingtonian that we know about, not necessarily
Yes.
the one that was tested today where we don't know where they're from. Is that person in a hospital?
Yes, yes, they are.
And so they're in a hospital next to them? Okay. And then today you met with lawmakers about what to do with the Capitol. Can you, were there any results of those meetings of the steps that you're going to take?
That meeting was purely informational. We did not provide any information that we haven't provided to you. I believe we provided all the same information this morning. I've got my notes from it that we provided, and I'm happy to answer any questions about it. With a state of emergency, we just wanted legislators to be able to ask any question that was on their mind and to have an open dialogue, but there were no recommendations, no requests of them. There were no additional requests of us.
I was talking about the meeting with leadership earlier this morning.
Oh.
What to do with the Capitol.
We
in terms of safety.
got it. We met with leadership earlier today. I told them where we are on the cleaning. I also talked to them about general potential steps we might take as the situation warrants it. But again, those are all planning steps that we'll advise you on if and when we have to take them. But it's about being thoughtful. If you look through the guidance on social distancing, on hand sanitizer, on areas like that, it's all just simply applying that as we need to here in the Capitol.
Do you think you're going to need to tap into the rainy day fund or ask for additional appropriations to deal with this?
So it's a little early, but I can commit that we will spend every dollar that we need to address the coronavirus. We've already declared a state of emergency, which opens up a pool of money that is directly appropriated, but we also have the ability to do more. I'll tell you that legislative leadership, when we met with them today, appears to be fully willing to work with us on whatever we need. I believe everybody is united in this, and the feedback that I've gotten thus far, as you tell us what you need, as long as it's reasonable, we want to make sure we help.
Have you had any discussions with leadership about SB 282, the bill that Senator McGarvey filed?
Not about the bill itself. And Senator McGarvey, I know, is trying to respond to all of this. The only conversations we've had is let's make sure that we're not taking our people off the front lines where they're working for other things right now. And I believe we have everybody's commitment there. Everybody wants to help. We may see some bills filed that in the short term, and this isn't one, wouldn't help, and all we'll do is communicate that, and I'm sure those legislators will respond appropriately. All of our interaction with our legislators has been extremely positive because everybody wants to respond to this in an appropriate way.
UK Hospital said that it's running low on some protective equipment. Does the state have a supply to assist hospitals as needed?
So we're working right now, both as a state and with our emergency management center open, to look at all the options that are there. I'll let Dr. Stack talk about our state supply, but we're also looking at the potential, if we need to, from private vendors. I know the federal government is working on this. We're not going to wait for that. We're going to look for every solution and every creative solution, and there may be some interim solutions too, because there are different types of respirators, for instance. And while some of them might not be perfect, they are better, and we're going to do everything we can. Dr. Stack?
So with respect to personal protective equipment, or PPE, we do have some resources that we can share. We have a process that necessary parties can go through to request that. On the Vice President's call today, we were informed that the FDA has said that the commercial grade N95 respirators that people use for sanding and painting and other things, that they've given, under the emergency conditions we have, approval that those can be used as a substitute even in healthcare facilities if they are unable to get the medical grade ones. And so that was good news because there's a much larger reservoir of commercial grade N95 respirators should people need them.
Yeah.
Has the state tracked how many times a physician has requested testing for someone?
Do we track that?
Can you explain a little bit more what you mean by that?
Like, as the doctor said, if someone has these symptoms, I think they need a test. Has the state tracked how many times that has happened?
What? Well, they probably, at a later point in time, they record all of the calls that come in, not video or audio record, but they document every call that comes in and the request and the action that they recommend. So I don't have that data because the team is busy working on making sure everybody who needs evaluation and needs care and information is doing it. At some later point that may be available, but not right now.
The way the calls go, and even going back to that first Harrison County, are very collaborative. As opposed to an order, it's the physician reaching out and discussing the patient and the CDC guidelines as they exist at the time. And I believe most all of our calls have come to a collaborative decision between folks. But that doesn't mean, the CDC has changed their guidelines on who should be tested since we conducted our first series of tests. And they're going to do so again. And so we do our best to follow what they have. With our resources, and again, the knowledge that we have is going to entirely change once the private labs are fully up and online. 2 of them are online now. They're ramping up their capacity. They're 2 of the larger national ones. But as universities and others come online, we're going to learn a lot, and there's going to be much more widespread availability.
What's the official tally on how many tests have been conducted and how many are still pending? The results are still pending.
So let me get the total number. It would be the total number we had run plus 13. What is it? 34. We have run 34, and I believe we have gotten a result from each one of those 34 now. So 6 positive and 28. That's what I thought. Negative.
With that, so sorry, I'm kind of stuck on the testing procedure. This is obviously going to change, but is there cause for concern that somebody might not qualify for the test but could have it, like in that situation in Harrison County?
Well, I think as we learn more about the coronavirus, it could be, and it's likely that it's more widespread than we believe it is. But when we've got a limited number of tests as it's still ramping up, I think what they're looking for are the most vulnerable populations, the people who show the most symptoms, making sure that we can get those tests in those circumstances. But all these healthcare professionals are doing the very best they can with something that is 2.5 months old. At the very end of this, we'll have learned a whole lot about it. And as we go, I think it's important that we react appropriately and do the best we can. Again, we got the news this morning that very first patient is improving, and that's really good news.
And it still takes 12 hours for a test to come back? That hasn't.
We can potentially get it done in less than that. If we get a case, because there are multiple tests in a case, but a case is one individual, by noon on a day, we can get it processed by, right now we're aiming for 6, but that day. If it comes afternoon, it could take until the next day. So some of these may be in slightly shorter than the 12 hours. But that turnaround time is one of my beliefs and why we are reporting some more cases than some other states. I don't think we've been hit harder. I just think we are more aggressive in how we're responding. I think that's a good thing for our people, and having the state lab get up online earlier helps us. And while we don't want to see positive cases, it does mean that we know, and it means those people can be treated. And it's much better to know than to not with that individual. All right. Well, we will have more information at 9 a.m. tomorrow. Thank y'all.